Hello, everybody. Thank you, Sue, for the introduction. And I want to tell you something about the situation in Germany. First of all, you see here in the slide the picture of our clinic, which had 276 beds. And that's the half of it is ENT and half of it is neurology. And we, in the ENT section, we are more than 100 hard of hearing people who are rehabilitated there from whole Germany. That's a special clinic even in Germany. So some people come more than 800 kilometers to get to our service. Next slide, please. And what's the current situation in Germany? We have more than 120 CI clinics. That means in 120 clinics there were the operation for CI, but that does not mean that in every clinic there is a rehab team. That's the problem. So we know that surgical treatment is important, but it's not everything. A high quality implantation is acquired, but the problematic phase of patients' rehabilitation is not acquired everywhere. So when you look what happens when a patient gets a cochlear implant, the patient meets a surgeon some days, sometimes 3-4 days maximum, but there is a lifelong care by a rehab team necessary. That is crucial. And so that's the thing we are talking about today, not the quality of operation, but the quality of the rehabilitation. What's the number we are talking about? Listening is exhausting. It's in hearing stress. And we have to answer the question, does the patient manage the daily routine or not? We have to ask, is the afterward activities, for example, in the evening, is it possible, or are the patients too tired to do that? Are there signs of social withdrawal? And we have to look if there are avoidance strategies after the fitting. For example, do the patient go on the phone, or is a partner phoning? No? However, hearing aid option and cochlear implant tools are often not trained and therefore not used. That's a big problem. And higher professional communications, communication requirements for multimedia system are necessary. We have a lot of jobs with high communication requirement. And communication problems often cause difficulties in the workplace and the social environment. Next slide, please. In our team, we have, first of all, CI engineers. You see here the leading engineers, Belagnes and Mrs. Rostik. But not only the engineers are necessary, we have a close cooperation with speech therapists, with audio therapists, with psychologists, physiotherapists, sport therapists, music therapists, social workers, and so on. And what's important, we have daily optimization of the CI setting. So we have regular team meetings so that every case is talked in the team, is projected what's the next steps are to do with every patient. Next slide, please. And we have 3 pillars of rehabilitation. First of all, improvement of communication skills, acceptance of one's own hardness of hearing is very important, and also the psycho-vegetative stabilization. Next slide. And Well, somebody, we are often even in Germany asked why daily CI setting? It's not too much. No. Why? Because with every cochlear implant setting, we offer new sounds to the CI user in small steps. These sounds seem strange at first. And the goal is for the CI user to get used to these new sound impressions by wearing the CI on a daily basis. Light tones, for example, are usually perceived as unpleasant at the beginning because they are new. In order for the CI user to become accustomed to these important frequencies, the threshold is increased daily, step by step, with the aim of achieving very good dynamics. At first, CI user responds sensitively to volume. It's too loud. But in the next day, in the first day, but the next day, maybe they perceive it as too quiet. That is very impressive. So you have a development and daily development in this hearing process. Next slide, please. So some spots in our modern rehabilitation concept, Bosenberg, that's the name of our clinic. You have high quality specialist rehabilitation. We have high technical and personal expertise necessary. The accessibility requires a lot of effort and a lot of time, sure. This can only be economically represented in large specialized facilities. So rehab is not a rest home, but rather a gym for the ear and more for the brain, because we are not hearing with the ear, we are hearing with our brain. An educational concept of communication information for CI users efficiently. In everyday life is quality control of rehabilitation concepts by health insurance and evaluation portals of rehabilitation clinics. Next slide, please. So we are using very often the group therapy. Why? Because they are set to changing core partner, to talk, to communicate with different partners. That means you have to improve your own articulation, because otherwise you would not be understood. That's a very important experience, not only how good I can hear, how good I can discriminate, but also am I be understood by the others. And listening, we have to train with and without technical accessories, and the holistic communication. That means watching, hearing tactics, discussion structures, and feedback. That are all topics they are learned in this daily group. Next slide, please. Here you see some examples. Sure, in the Corona, in the COVID time, the groups are a little bit smaller and the distance is bigger, but you see that is the thing. It's very impressive and exciting group sessions here. So next slide. And when you think hearing with cochlear implant is not only to understand speech better, but you enter a new hearing world. And that means, for example, the nature sound, but also the music. You know, many CI users have not a good relationship to music because they are a terrible impression. But we know we can lend people with CI, with cochlear implant to music when you go it in the right way. Even we have rhythmic and melodic training, and even we awake old memories of music, what they had heard and learned before. We have dancing group we have a CIICA, and we have music relaxation training, and even some patient learn new instrument with cochlear implants. That is very impressive. Okay, next slide. What's very important is a technical area, phone, communication systems, and so on. And we have to train all these devices with the patient, because otherwise they don't use it. Meanwhile, for example, the fear of not understanding on the phone is a very important thing. Or to use the decoy. Many of even the hard of hearing people with hearing aids, they don't know the decoys. We have to train them. We have to show it. Next slide, please. Yeah. Next slide. So here is one of the highlights in our rehabilitation. We call it a sound lab, Klangraum in Germany. And that means we have 8 loudspeakers in a full circle, and we have a program which can simulate more than 100 professional situations. So what is the problem? We want CI users to go back to their work, but they fear to go back to the work in even very high specialist context, like teachers, like consumer advisors, and so on. And we can simulate this working scene with this sound lab. It's very impressive. So people lose their fear. They are forced in their decision to go back to work. Okay, next slide, please. So the goal of Bosenberg is we wanted 80% of cochlear implant users should be reintegration into the profession within 3 months after the operation. Through optimal rehab process, we also, and that's important, reduce the total cost for reintegration. When you think the rehab process will last half a year or even longer, sometimes years, you lose. You have to have a lot of costs for support them because they cannot go back to work. And when the faster you reintegrate, the sooner you get workers, you get very motivated members of our working team. Thank you for your attention.
Thank you, Harald, very much. That was a really comprehensive account and stimulated much discussion in the chat room, particularly about about music and how people had valued music in their own rehabilitation and so on. And Reinhard putting in about his choir too. Brian, I think there were a couple of questions. Would you like to bring up, Brian?
Yeah, there's so many here. As you say, it's provoked a lot of discussion. I was wondering, one kind of key overall question that comes out for me of all of this is, how easy is it, Harold, for you to get the funding that actually supports this incredible activity you've got?
Yes. So it is in Germany, we have 2 kinds of funding. First, it's the health insurance. The health insurance has the task to take over the cost for the implantation and for the first fitting, and even for the aftercare. And the second cost holder is a rehabilitation case. We call it DRV. It's very important that are used by the members who take part in the working space, because the goal there is to go back to work and to have a good, taxpayer, if you want. It's better to have taxpayer than you support by costs with people who don't work any longer. So that's an important thing, and with this we can manage that a positive outcome, even in the economical space.
And how do people get to your centre and from your centre was another key question, in terms of how accessible is it basically for people?
So in Germany, it's just accessible for all members of the healthcare, so for everybody. And but it's important you have to make an ask by an ENT doctor, for example. You go to the ENT doctor in Germany, and when there is a need of rehabilitation, they make a special report and special ask. So we have that lasts sometimes some weeks, sure. But when you have the first fitting, we have a complete system from the operation to the first fitting, which is taken over by the health insurance case. You understand? So, and the rehabilitation is afterwards, after 3-4 weeks after this first fitting, and it lasts 3 or 4 weeks in our clinic.
Harald, that's fascinating. I think we could spend the whole of the rest of the session just on your content there, but I think we probably need to move on. But please do keep commenting in the chat room, and we'll capture all those comments as well.
Yes, and our website is increasingly used by people making comments in the current issue section, and we can keep that going. And there's one just in from Reinhardt, Brian, that you probably didn't manage to see, commenting about the importance of strong user groups. You have strong user groups in Germany. And Reinhardt called user groups the fourth foundation of the health system.